My name is Conway Ficklen. In 1976, I was 50 years old, and my staff teased me for being 1/4 as old as our country. I was also president of the New Hanover County Medical Society. At that time, it was New Hanover-Pender and Brunswick County. There's two things that stand out in my mind that happened. We integrated when we moved into New Hanover Regional Medical Center, and we were having our county medical meetings at the Cape Fear Club, men's club downtown, which was segregated. Cape Fear Country Club was segregated, so we went to the blockade runner. They not only accepted us, they made us feel welcome, and we had a wonderful meeting and association with them. During my presidency, one of the things that we did that I'm proud of is we started through the AHEC school at New Hanover a fall symposium where we invited doctors from the different medical schools from South Carolina to Maryland to speak on different subjects in medicine, and that was usually in September. We had the medical meetings in the morning. In the afternoon, they could use the beach or they went to Duck Haven Golf Club, I think. And then the other thing that we did then, at the end of the day, we had a banquet, and that lasted for 2 days. It was quite an event. It was well attended. When I came here, I was the 54th doctor in Wilmington in 1959. Bill Wynell came the year before. He was number 53. That's all of the doctors here. I think now there are more than 540 doctors here now. I think the other thing that we had was most every doctor attended the County Medical Society meeting. And a couple of the funny things that happened, we had Rolf Fisher, who was a psychiatrist, and he was from Holland, and he was a treasurer, and he gave a very interesting treasurer's report always, and we got a laugh out of it. And the main subject, did we have enough money in the treasury to buy the whiskey for the next meeting? Now that about sums up what I did as president. But the integration was the main thing, I think. Now we do meet at the Cape Fear Country Club, and I am too old to go now. Now I'll tell you, I'm a retired obstetrician gynecologist, so this comes down my field. A couple in their middle ages started going to the movie together and dining out, and they got romantic. So they sat down and discussed getting married. And they said, well, what about our children? How are we going to work that? So they talked about that. Said, well, now we have 2 houses. Which one shall we live in? So after they got the finances and everything worked out, there was a pause, and she looked at him and she said, what about sex? He said, infrequently. She thought a minute. She said, is that 1 word or 2 words?
I'm Carl K. Rust II, better known as CK. I was president of the New Hanover-Pender County Medical Society in 1990. It was a good year. We met multiple times at UNCW, at their cafeteria. We had other meeting places because it was the time when we had difficulty having places to meet. We had one of the best things that happened during that year was we established started the Community Health Center. And this came up in a meeting that we had when the rural health people attended and talked to us about indigent care and how people that weren't insured were getting the medical care. And I appointed Dr. Dan Gottovi to head up a committee, and he worked with the Rural Health of North Carolina, and we established the Community Health Center on the north side of Wilmington. It's now known as the Northside Clinic. It does not meet all the needs that we anticipated for it to do, but it did for a while. So in some respects, we're very proud that the Medical Society participated in it, but in other ways, we're disappointed. Another thing that happened during that year, most of the years it happened, we had the Bald Head Retreat, which was going strong. We had good relationships with the pharmaceutical representative because the pharmaceutical companies at that time had not gone to primarily advertising on TV. So they brought in good speakers, and we had great speakers and good rapport with them. A lot of samples they would leave with us in the physician offices. During the meetings, we had great social intermingling among the physicians. We got to know each other. We had fun doing fishing trips and did our own medical CME credits from our own meetings, and we had great meetings, and a lot of this came from pharmaceutical companies and their help. We did not owe them anything, and they did not request anything from supporting us. CME was easy in those days, and it was much simpler during my period as president of the Medical Society, because a lot of regulations have come in and different things are happening that we didn't have to experience at that time. I went on to become president of the new North Carolina Medical Society, and I was president during the 150th anniversary, and it was a wonderful time to be president. But it wasn't all a celebration because we had hurricanes and floods, and the Medical Society responded to that along with helping New Hanover-Pender County Medical Society. All in all, my experience with the Medical Society has been very rewarding. As a member of the AMA, I was on the Long Range Planning Committee and helped set up a lot of the things that unfortunately they're not following today. And so I'm no longer a part of that. The thing I think that I got most out of being president and still a member of the New Hanover-Pender County Medical Society is getting to know the physicians. At that time, the physicians took care of their patients. And one other thing that happened in 1990 was we had a crisis with infectious disease physicians, and that we had already lost two. One had moved out of town, and one had totally quit practicing infectious disease. And so the Medical Society, with my assistance as president, came to bat for our infectious disease doctors, and that is why we have infectious disease doctors today, and they didn't all leave. So other physicians, when they had a need and the Medical Society could assist, we rose to the occasion, and either through the media or whatever required for it to be done. I wouldn't take anything from my time with the Medical Society. It helped me to become a part of the medical community here in Wilmington, got to know a lot of great physicians. Met Dr. Reynolds when I first got here, and he was just finishing up being president of the North Carolina Medical Society, and he has gone on to do many, many things. Dr. Burt Williams, whom I wouldn't give anything for meeting him. I've taken care of their families, and as a physician, and I retired in 2000, and have been busy since then, still doing things in the medical field, but not seeing patients.
My name is Michael Moulton. I was the president for the Pender New Hanover Medical Society in 2005, which seems like a long time ago. I also became the president of the North Carolina Medical Society in 2012-13. That term starts in 2012 and runs into 2013. Medical Society 2005 was, of course, still run by Bonnie Brown, which seems a long time ago, and has changed and evolved, I guess, significantly from back when I was president. When I was president, it was the Alliance was still pretty active back then. My wife was president of the Alliance at that time and did all the paperwork for them. I think that kind of tapered off. Do you remember, Bonnie? Probably about 2 or 3 years after that, it kind of started fading down. Some of the topics that were big back then were tort reform. We had when I was president, we had a year of Senator Burr came and talked to us about tort reform. He also came and talked to us about and introduced a bill about tort reform, and we worked on that, trying to get significant tort reform passed in the State House for, it didn't pass, I guess it passed finally in 2011. Other things that were going on back at that time, that we were still having trouble with certificate of need in the state, trying to get people to be allowed to open surgical suites, GI suites for endoscopy and stuff like that. So that was a fight back then. It's still a fight today. It still has not been resolved. We also did an interesting thing, was kind of neat, was we did a interview panel with Dr. Warschauer, Dr. Bertram Williams, and Dr. Frank Reynolds. We talked to them about how medicine was being practiced when they first came to town. Back when they did house calls, they used to they had a trolley that went back and forth between Wrightsville Beach. It was a time where they were paid sometimes with chickens. So that was kind of a fascinating program. We have that on tape somewhere, I guess, which is pretty interesting. My favorite thing I did as president, when I got those three of those guys together to talk to, and get them to tell us how medicine was a long time ago. It was a fascinating story. It really came off very nicely. My favorite accomplishment would be keeping the ball rolling on tort reform up until we finally got significant tort reform done in the 2011. I think it was 2011 or 12, right around then. 2011, I think the tort reform was done. That would be my favorite accomplishment.
Hi, I'm Dan Gottovi. I was president of the New Hanover, then New Hanover-Pender Medical Society in 1994. The things I felt best about that year were two things, thinking back. Number one, we provided benefits for our part-time administrative assistant so that she could become full-time. And number two, we supported the establishment of the Community Health Center, which is down on North 4th Street. It was the New Hanover-Pender Community Health Center. It is now Northside Community Health Center, but the Medical Society had to endorse that project to get it through the administrative hubs. So those are two of the things I feel best about. I can remember the meeting where the whole idea of a community health center came up. It was in the Madeline room out at UNCW. And someone raised the question, what if there aren't enough primary care doctors to provide increased Medicaid and Medicare coverage? And I think Henry Hawthorne is the person, or Gordon Coleman raised that question. And the person there as a speaker that day said, well, some communities form a community health center. And that was the first time it was mentioned. And we went on and did that, went through the steps, which included a Sears catalog-sized document that went to the feds. So those are the main things that I can think back on.
I'm Jim Kesler. I was president of the New Hanover County Medical Society in 1991. First, I would just want to thank Bonnie Brown and the New Hanover-Pender County Medical Society for inviting me to participate in this 150-year celebration. From the day I was accepted in medical school, I've always thought it was a privilege to be in medicine. Nowhere beyond the New Hanover-Pender County Medical Society do we see that privilege exhibited more. The examples from people like Tom Marshburn, Frank Reynolds, Burt Williams, Ellis Tinsley, Harry Van Velser, Sam Warschauer were an inspiration to me and very important to me as a young physician. When in 1990, I think it was 1988, I was asked by Neil Musselwhite to join the executive committee as the program chairman, and I think that group was probably the most visionary group that I've ever been associated with. And not only Neil, but Jim Hundley was there. C.K. Rust and Bob Jones. Our motto was unity for the community. And many of the innovative programs that have come from our society came from that group. The ones I think of are the Bald Head Island Medical Retreat, the Health Hotline, the UNCW Scholarship Program, Medical Scholarship. I think the doctor-lawyer meeting, and one of my favorite meetings was Bones McKinney. He was a former NBA basketball star and coach of Wake Forest. And that was the first meeting that we were subsidized by an outside source. That was kind of unusual at that time. When my year, I was fortunate, that was 1991, I was fortunate to be surrounded by talent and wisdom. Gordon Coleman was my president-elect. Charlie Vernon was the program chairman. Henry Temple and Mark Foster were there, and then C.K. Rust and Frank Reynolds were there as well. We had some great times, probably highlighted by Charlie Vernon's skit with the Doctor Lawyers, which was an irreverent, definitely non-politically correct, a lot of fun. It was starring Dennis Nix with a cameo from Neil Musselwhite in drag. And so it was very, luckily there were no cell phones back then to take videos. We also did some serious things. The New Hanover-Pender County Medical Society that year was obviously the most active county medical society in the state of North Carolina. And also we managed to balance the budget, which had not happened since the days of Jim Deneen and his famous Christmas parties. The other thing I would think about is a couple of people I'd mention as well. One is my dear friend, Mike Donahue, who was a past president, and then I think he was a counselor from our district for years at the state level, and he was continually involved. He was pretty much responsible for getting the health hotline on the air with WWAY, and he also singularly brought the Bald Head Island Medical Retreat back. And to me, those were two of the most important programs that we had. The hotline, to me, was an example of the medical society in action. To see 20 doctors behind the telephones answering phone calls from anonymous patients and being able to answer all their questions just demonstrated the breadth and knowledge that we have in our medical community. And also, it kind of demonstrated that we were much more powerful as a group than we are as any individual. The medical retreat was just a delight, and it was a chance for some education, but more importantly, it got families and doctors together in a relaxed atmosphere, and friendships that have lasted forever were developed from that. The other person is Clayton Calloway, who was our parliamentarian, and he gave us courses in parliamentary procedure. He helped us have efficient meetings where we could have discussions and debates in a thoughtful manner and an efficient and timely manner as well. So I really appreciated those two. Of note, also during my year as president, John Dees of Burgall was installed as president of the North Carolina Medical Society, and Connie Parker in the same year was installed as president of the North Carolina Medical Society Auxiliary. So it was truly a great year for medicine in New Hanover County. To me, the essence of the medical society is the example and the inspiration that is passed from one generation to the next. It's sort of like paying it forward. And in my view, I'm confident that the New Hanover-Pender Medical Society can go on for more than another 150 years. And so again, I thank you for letting me be part of this program, and happy birthday, happy 150th birthday, New Hanover-Pender County Medical Society.
I'm Jim Hundley. I am a retired orthopedic surgeon. I was president of the New Hanover-Pender Medical Society in the year of 1989. It was quite an eventful year in that we had a lot of things going on. We were having a professional liability insurance crisis and a lot of contentiousness between attorneys and physicians, and that was the year we tried to improve relationships between the doctors and the lawyers and started a fishing tournament where we made the lawyers and the doctors all be on the same boat, so if they didn't kill each other, maybe they'd get along. That was one thing we did. I think we had a shrimperoo following that year, and that continued for quite a while, and it may have helped. Lots of other stuff was happening. The AIDS crisis was in full bloom, and there was a lot of misunderstanding, and really we just didn't know exactly how to manage it, but someone in our society and our members stepped up and wanted to form a committee to be sure we were treating patients properly, and we formed that committee. Someone else wanted to start breast cancer screening, and we started that. We had the Mercy Ship Anastasis come to town, and we made tours of that, and they presented to our society. It was quite an experience to see them. I think one of the highlights was with the Albert Schweitzer Awards that were held at UNCW, and we hosted a reception and got to meet Dr. George Hitchens, who was a Nobel laureate in chemistry, which was quite an experience for us and an honor for us. Personally, one of the things that has pleased me the most has been the pre-medical scholarship that has been continued for quite a while. When we came to town and started doing some things with UNCW, where I was team physician at the time, we learned that there had been only one student who had ever gone to medical school from UNC Wilmington. We began that scholarship in hopes of enticing more students to take up the medical profession. And the best I know, we've probably had at least one or two students every year since then who've gone into medicine. The interesting things about that is that typically physicians will give their referring physician, the specialist will give his referring physician some kind of gift like a bottle of wine or a dinner or something like that. When we started the pre-medical scholarship, I think it was Bonnie Brown whose idea it was that those gifts should be donations in honor of the physicians to the scholarship. And so that has built that fund up, and it's continued with a lot of support from staff. And I think now we have an endowment of well over $200,000 in that. Some of the really fun part of that was sitting on the committee to select the students, and we would have 4 or 5 students would be selected by the pre-medical advisor, and they would come and we would read their curriculum vitae, and then we would interview those students, and it would be 3 members of the medical society and 3 faculty members at UNC Wilmington. And I'll never forget listening to all the things these young people did at the time. And one of the faculty turned to me and he said, "Well, Jim, did you do all that when you were a sophomore in college?" And I said, "When I was a sophomore in college, I was still trying to find my shoes. I had no idea how to do any of that stuff." But just such bright people who always gave us a lot of hope about the future of the world. In closing, I would just like to say I think the Medical Society remains very important. There's nothing like knowing the people you work with, knowing the people you refer to, the physicians and the other medical providers that you get to know. There's nothing like knowing when you pick up the phone who you're talking to. I know medicine is changing rapidly, but I would just like to say that I know that it is still a spectacular profession. I'm awfully glad I was able to go into medicine. I feel very fortunate that I did. I know that we hear that no one's going to want to go into medicine, but I also know that at UNC Chapel Hill there are about 7,000 applicants for 180 positions. So a lot of people want to go. And the reason is it's such a gratifying profession. So I think the profession will continue to be one of great service, and I think that I hope that all of these young doctors will continue to meet in groups and get to know each other and help support each other. Thank you very much.